24 hours at over 3,62,000 recoveries, outnumber new cases yet again. As per the latest numbers from Health Ministry, over 18.2 crore vaccine doses administered so far. Over 20 crore vaccine doses provided to states, union territories free of cost. Delhi extends lockdown by a week. Second consignment of Sputnik 5 vaccine arrives in Hyderabad. Production capacity of the Russian vaccine in India to be increased to up to 85 crore doses per year. Russian ambassador says there are plans to introduce the single-dose Sputnik Light version in India soon. The first oxygen express to Kerala reaches Ernakulam from Kalinganagar in Odisha. Third loaded oxygen express for Tamil Nadu arrives. High alert sounded for several districts on the west coast as cyclone tautae intensifies into very severe cyclonic storm. Home Ministry reviews preparedness. Heavy rains continue in Kerala, Maharashtra, Goa. Cyclone is expected to intensify further and reach Gujarat coast on Monday evening. In international news, the home of Hamas Gaza chief bombed by Israel as hostilities stretch into the seventh day. Israeli Premier Netanyahu says the operation will continue as long as necessary. UNSC and OIC will discuss the issue today. And in sports, Leicester City beat Chelsea 1-0 to win their maiden English FA Cup title. 21,000 attend the finale at Wembley Stadium after easing of COVID-19 restrictions in Britain. And in tennis, 9 times winner Rafael Nadal will face top-ranked Novak Djokovic in the finals of the Italian Open tournament today. Namaskar and welcome. You're watching DD News. I'm Sakal Bhatt and the top story we're tracking at this hour. The Ministry of Health and Family Welfare has issued detailed guidelines on COVID-19 containment and management in the peri-urban, rural and tribal areas amid rising cases of coronavirus in rural pockets. Now, the ministry has placed special emphasis on active surveillance, screening, isolation and referral in such areas, stating that testing needed to be expanded by special training of nodal officers with the help of the Village Health Sanitation and Nutrition Committee. A 3-tier system has been planned for health infrastructure for managing COVID in a rural area. Symptomatic cases to be sorted at village level by teleconsultation with community health officer. Patients to be counselled to isolate themselves till test results are there. Contact tracing to be done as per Integrated Disease Surveillance Program guidelines. Asymptomatic having history of exposure to COVID patients to be quarantine tested. The Health Ministry has also given special guidelines for home and community-based isolation for rural pockets as per the ICMR guidelines. The health infrastructure for managing COVID peri-urban rural areas to plan a minimum 30-bed COVID care centres, district hospital, private hospitals to be converted into dedicated COVID hospitals, COVID care centres to offer care for asymptomatic cases with comorbidities, COVID care centres to admit COVID suspect or confirmed case, COVID care centres to have separate areas for suspected confirmed cases with separate entry or exit, and also COVID care centres will also have basic life support ambulance. For cleaning and disinfection, that's on your screen, suitable provisions for disinfection of floors, surfaces to be done at least twice a day. All frequently touched surfaces to be cleaned with 1% sodium hypochlorite solution. Disinfection of ambulances transporting patients to be done after every visit. And for post-COVID management, let's take a look at the post-COVID management SOPs as well. Medical officers to follow with recovered patients for post-COVID complications. Patients to be counselled for post-COVID management at home after recovery. Patients with other comorbidities to be followed up for further assessment. On your screens are the SOPs for post-COVID containment. And now let's take a look at the latest on COVID-19 in terms of numbers. Now, according to the Ministry of Health and Family Welfare, more than 3,11,000 COVID-19 cases have been reported in the last 24 hours. More than 3,62,000 patients have been recovered in a single day after undergoing the treatment. At present, total number of active cases in the country is around 36,18,000. In the last 24 hours, 4,077 people have died across the country. At the same time, the total figure of the dead has also reached 2,70,284. The total number of COVID-19 cases across the country have reached up to 2,46,84,000. And the cumulative number of COVID-19 vaccine doses administered in the country stand at 18,22,20,164. More than 14 crore beneficiaries have received their first dose of COVID vaccine, and more than 4 crore have received their second dose of COVID vaccine. As on day 120th of the vaccination drive, that is 15th of May, that was yesterday, a total of 17 crore plus vaccine doses were given to 11,30,928 beneficiaries, which were vaccinated for first dose, and 6,02,304 beneficiaries received their second dose of vaccine in the last 24 hours. More than 20 crore vaccine doses have been provided to states and union territories free of cost by Government of India. More than 1.84 crore doses are still available with the states and union territories to be administered. Nearly 51 lakh doses in addition will be received by the states, union territories in the next 3 days as well. Meanwhile, India continues to put up a strong and spirited fight to beat COVID-19. The country continues its mass-scale COVID-19 testing drive. As per the Indian Council of Medical Research or ICMR numbers, 18,32,950 samples tested on May 15, taking the cumulative total to 31,48,50,143. Bharatiya Janata Party Chief JP Nadda on Sunday flagged off 17 mobile medical units and medical aid for Himachal Pradesh under the Seva Hi Sangathan program to help the state battle COVID-19 pandemic. Union Minister and BJP MP Anurag Thakur was also present on the occasion. Speaking on the occasion, party chief said that amid the second wave of COVID, many of our workers are working tirelessly along with hospitals, and with that we are giving all the possible facilities in view of testing. People are continuously receiving help with hospitalization, testing and vaccination, unquote.
भारतीय जनता पार्टी का कार्यकर्ता इस संक्रमण काल में भी अस्पतालों के साथ जुड़कर लोगों की सेवा में जुटा हुआ है। यह निश्चित रूप से जो विपदा आई है, यह हम सब लोगों ने मिल करके इससे निपटना है और आगे बढ़ना है, और इसलिए भारतीय जनता पार्टी के लाखों कार्यकर्ताओं को हमारा ये संदेश रहा है और कैसे हम नीचे तक इस संक्रमण काल में अपना योगदान कर सकें, इसके लिए दिन रात एक लगे हैं। जो 17 आज हमारे मोबाइल वैन्स, मेडिकल वैन्स, ये आज नीचे तक पहुंचेंगी, पीपी किट्स पहुंचेंगे, अदर फैसिलिटीज पहुंचेंगी, उसके लिए जो व्यवस्था की गई है उसके लिए मेरी शुभकामनाएं भी हैं और बधाई भी है।
Now, according to the Union Health Ministry, there are 39,575 active coronavirus cases in Himachal Pradesh and 2,254 have died due to the deadly disease. And amidst the second wave of COVID-19 pandemic, Ashutosh Sharma, Secretary, Department of Science and Technology, shared his views with Doordarshan News regarding the challenges posed by new mutated variants, limitations of the mathematical models and also strategies to control spread of infection. Here's an exclusive interview with my colleague Tapas Bhattacharya.
DST, or for that matter the scientific community, was prepared the kind of situation that has engulfed the country post the second wave of the pandemic?
Well, you know, when the first wave was going down, many different inputs from different streams of knowledge were obtained by the government. This includes many different ways to predict the future or to estimate it. Now, of course, different agencies and committees, they have been looking at it. They looked at all of this data in a very holistic manner. DST has been involved in looking at the predictions of some of the mathematical models of pandemics, both globally and in India. most of them predicted about 1 lakh per day peak values somewhere at the end of April to mid-May or even later on from there. So certainly the intensity and the ferocity and the speed of the second wave that we have seen now was not predictable. And that has happened with many countries, not just with India, that the second wave has hit harder than the first wave. And that happens because there might be rapid changes in the mutation of virus as well as the behavior of people and the virus, the transmission of virus, the impact of virus, the interaction between people and virus, as well as the mutations. All of these were not foreseen.
It is imperative to have vaccination done to most of the people. How important is to get it done for the young generation, young people, especially under 18 or under 40 population? And how do you think that this is going to be a major game changer in the fight against COVID-19?
See, herd immunity basically means that maybe about 70% people have antibodies, either because they have been previously infected or they have a proper vaccination. Right, so now we already know that the government has announced that by the end of December that this kind of population would have vaccination, plus together with people who have antibodies in sufficient amount. Now the herd immunity basically is a combination of these two factors. And I certainly think, based on all the efforts which are going on in vaccination, all the efforts which are going on in appropriate behavior, that people understand that very well, that this is not over. So a combination of these factors would be able to take us out of these pandemic times. What is special about second wave is what I was focusing on is about oxygen and home care. So we don't want everybody to be in hospitals. If they don't have to be there, no ICU, nothing, then you have to manage at home, and that requires oxygen support. And so that is where our focus right now is.
A lot of people are talking about herd immunity. Is it 60%? Is it 70%? 80%? What is the mathematical model? How do you rate this, and what is the way to go about it if one has to have herd immunity in the country? Especially, even if it's not for the country, even let's say for pockets or cities like Delhi, which one you think is the right model?
No, it's related to question you asked about vaccinating the young as well. Of course, eventually it has to be universal vaccination program. Right now, when the supply is more limited, one must have priority. And that priority is based on age, it is based on comorbidities, it is based on your job profile, how many people you interact with and so on. And that is how every nation has done it, and we have followed the same strategy. Now, herd immunity, you see whether 60% or 70% is not told by mathematical model. It depends on the conditions of mixing. In other words, people who have not gotten the virus so far, how much do they come in contact with people who are infected, who can pass on the virus? So this is the most critical thing. So it depends on your protective measures, it depends on your travel, it depends on whether new people are being exposed, and most importantly, at what frequency or over what time are they exposed. So if it is slow process, which it certainly becomes after 70% people have antibodies, then it is called herd immunity. And so basically means herd immunity does not mean that nobody will get infection. It means that it would be very slow, and that you are able to totally address and manage it effectively.
That was Professor Ashutosh Sarma, Secretary of DST, telling us that important steps have been taken by the government of India in order to be absolutely prepared, not just for the second wave, but at the same time prepare themselves for the third wave as well. With camera person Sumit, this is Tapush Bhattacharya, Doordarshan, Delhi.
And the Government of India is also tirelessly working in its efforts to fight against COVID-19 pandemic. And in line with this, Haryana Chief Minister Manohar Lal Khattar and Petroleum Minister Dharmendra Pradhan have dedicated a new oxygen plant and 500-bed hospital at Panipat refinery. Oxygen will be directly supplied to hospitals via pipeline. Union Minister Dharmendra Pradhan on the occasion said that the country has decreased consumption of oxygen in steel and pharmaceutical industries in a bid to meet the high demand of oxygen across the nation.
आज देश में प्रतिदिन 10,000 मीट्रिक टन लिक्विड मेडिकल ऑक्सीजन की खपत होती है। देश भर से विशेष करके स्टील सेक्टर और पेट्रोलियम सेक्टर जैसे हमारी इस पानीपत रिफाइनरी में 200 मीट्रिक टन लिक्विड मेडिकल ऑक्सीजन या इंडस्ट्रियल ऑक्सीजन बनता था, जिसकी कैपेसिटी को बदल के अभी 280 मीट्रिक टन तक ले गया गया है। ऐसे आज स्टील की उत्पादन, पेट्रोकेमिकल प्रोडक्ट के उत्पादन को घटाकर देश और हरियाणा जैसे प्रदेश की स्वास्थ्य जरूरतों को ध्यान में रखते हुए आज हम सब राज्य सरकारें, भारत सरकार मिलकर हम लोग आज ऑक्सीजन की व्यवस्था कर रहे हैं।
Lockdown has been extended in Delhi for another week. Delhi Chief Minister Arvind Kejriwal announced the extension of COVID-19 lockdown in the national capital till 24th of May. It will be further extended for 1 week till Monday, 5 a.m. to check the COVID-19 spread. And with Delhi witnessing a steady dip in the number of COVID-19 cases and the positivity rate, the capital recorded 6,430 cases with 11% positivity rate. The recovery was 11,591, but the daily death number was still very high at 337. Till yesterday, the national capital had over 66,000 active cases. And the second consignment of the Sputnik 5 has arrived in India today. Sputnik is among the 3 vaccines approved in the country, and the first consignment of Sputnik had landed in India on 1st of May. However, the regulatory clearance from the Central Drugs Laboratory, Kasauli, was given only on 13th of May. Sharing the news, Nikolai Kudyshev, Russian president to India, shared the picture of the second consignment on Twitter, and he said, and I quote, "A second batch of Sputnik 5 has landed in Hyderabad today. We are very happy to see that the Russia-India joint fight against COVID-19, which is one of the vital areas of bilateral cooperation nowadays, has firmly stood on rails and moving forward," unquote. In fact, the Russian ambassador said Sputnik 5 is Russian-Indian vaccine. He said Sputnik's production in India will be gradually increased up to 850 million doses per year. He added that there are plans to introduce single-dose vaccine soon in India, Sputnik Light. The Russian ambassador also said that the efficacy of Sputnik 5 was well known in the world. In Russia, he said it was being successfully used to vaccinate citizens starting since second half of 2020. Russian specialists have declared it's also effective against new COVID-19 strain. The third loaded oxygen express for Tamil Nadu has arrived. Oxygen express loaded at public siding at Tata Nagar, Jharkhand, for inland container depot at Todiyapret in Chennai, Tamil Nadu, with 2 containers carrying 40 metric tons of liquid medical oxygen arriving at the destination at 10:30 hours today. That's 10:30 in the morning. And with this, the total oxygen delivered for Tamil Nadu stands at 151.4 metric tons. And shifting focus to cyclone-related news, high alert has been sounded for several districts on the west coast as cyclone Tautae intensified into a very severe cyclonic storm. The very severe cyclonic storm Tautae over East Central Arabian Sea moved nearly northwards with a speed of about 11 km per hour during past 6 hours and lay centered at 5:30 am today over East Central Arabian Sea. The India Met Department has issued a warning that it is very likely to intensify during next 24 hours, likely to move north-northwestwards and Gujarat coast in the evening hours on Monday, 17th May, and cross Gujarat coast between Porbandar and Mahua around 18th May early morning.
अभी फिलहाल वेरी सीवियर साइक्लोनिक स्टॉर्म इस सेंट्रल अरेबियन सी में है। हम बिरावल से 660 किलोमीटर दूर में है। उसका मूवमेंट नॉर्थ वेस्टवर्ड रहेगा। हमारा कोस्ट का पास में 17 तारीख इवनिंग में पहुंच जाएगा। 18 तारीख सुबह में अर्ली मॉर्निंग में हमारा गुजरात कोस्ट क्रॉस करेगा। पोरबंदर से लेके महुआ का बीच में, महुआ भावनगर डिस्ट्रिक्ट में आता है, उसका क्रॉस करेगा वेरी सीवियर साइक्लोनिक स्टॉर्म में। उसके लिए विंड स्पीड भी उसका 150 टू 160 किलोमीटर पर आवर, गस्टिंग टू 175 किलोमीटर पर आवर रहेगी। कोस्टल एरिया में भारी से अति भारी और एक्सट्रीमली हेवी रेन होने का संभावना है। अहमदाबाद में, साउथ अहमदाबाद में भी उसका इफेक्ट रहेगा। हेवी टू वेरी हेवी रेन भी हो सकता है, विंड स्ट्रॉन्ग विंड भी रह सकता है।
The Indian Air Force has kept 16 transport aircrafts and 18 helicopters operation ready in peninsular India as a preparation for the cyclone tautae. The cyclone is expected to cause very heavy to extremely heavy rainfall along the western coast of India in the next few days. 127 personnel along with 11 tons of cargo have been airlifted from Bathinda to Jamnagar in IL-76 aircraft. Meanwhile, one C-130 aircraft has also airlifted 25 personnel and 12.3 tons of cargo from Bathinda to Rajkot, and other two C-130 aircraft airlifting 126 personnel and 14 tons of cargo from Bhubaneswar to Jamnagar. Meanwhile, Indian Navy too undertook relief operations as a relief team from Southern Naval Command started rescue operations in cyclone tautae affected areas of Chillanam coast of Kerala. Now towards providing assistance to flood-hit villages of Malaigharipatti and Kampanipadi as well as Maruvakad in Chillanam. 3 naval diving teams and 1 quick reaction team from Southern Naval Command swung into action. The teams undertook rescue of personnel, provisioning of food and water and shifting of people trapped in houses to relief camps at St. Mary's High School, Chillanam in the harsh weather conditions. From Kerala, moving on to Maharashtra, Union Home Minister Amit Shah chaired a review meeting with the Chief Ministers of Gujarat, Maharashtra and administrators of Daman and Diu and Dadra Nagar Haveli to assess the level of preparedness of these states and the central ministries agencies concerned to deal with the situation arising out of the cyclone tautae. In the meeting, Home Minister specifically reviewed the preparedness of all the health facilities, especially adequate power backup arrangements in all COVID hospital labs, vaccine cold chain and other medical facilities in the areas likely to be impacted by the cyclone. Under the influence of cyclone tautae, high-speed winds and rainfall have hit the Sindhudurg district of Konkar in Maharashtra. The height of the waves is gradually increasing at the Kailas port in Vengurla taluka of Sindhudurg. Electricity supply has come to a standstill in many parts of the district. The rains have started with strong winds in the coastal areas. The people of coastal areas are now on alert. Warning has been issued to fishermen not to go to the sea. Effect of the storm is not just limited to the coast but to the interiors as well, as several other districts are witnessing rainfall. Rain has hit Pune, Sangli and Ahmednagar districts of the state. It has been raining since last night and has continued till this morning. Also, as a precautionary measure, a total of 580 COVID-19 patients have been shifted to various municipal hospitals from Mumbai's Dahisar Bandra Kurla complex and Jumbo COVID Health Center in Mulund. Also, 3 teams of NDRF have been deployed in Mumbai and other teams are on standby as and when required. Quick update from Shishir Shlehar joining us from Mumbai. Shishir, very quickly overview of the arrangement that have been put in place to minimize the impact of cyclone, and also very important meeting that was taken by the Home Minister himself today.
Well, absolutely, Sakal. If you look at the current situation, especially as far as cyclone tautae is concerned, it's moving toward the northwest. It's already entered from Goa and will coastline of India, that is from Konkan region of Maharashtra. The couple of districts in Konkan region have already put on alert. For example, Ratnagiri and Sindhudurg district have already witnessed rainfall since yesterday afternoon, as the effect of the cyclone here. And since morning, we also witnessed the very heavy rainfall in this region. And of course, as far as the sea is concerned, we've also seen a large tides during this entire period here. in particularly Sindhudurga and Konkan region. Well, Mumbai won't have much impact of the cyclone, but in spite of that, the Mumbai is put on alert. And you rightly said, the local authority in Mumbai have already alerted the concerned department here. The NDRF, along with the state disaster relief team, have also swung into action. As far as Mumbai is concerned, Sakal, let me tell you that Mumbai is also witnessing a very high numbers of corona patients every day here. And that's the reason, as far as the jumbo COVID centers are concerned, which are situated near the Mumbai, the patients in this jumbo COVID centers have been shifted to the hospitals here now, because of the most of these jumbo COVID centers are makeshift hospitals.
Okay.
And that's the reason, as far as the winds are concerned, the rain is concerned, and that's the reason, keeping this in mind, the government have taken a precautionary measure and shifted the corona positive patient to the permanent structures in other hospitals in Mumbai. As far as Konkan region is concerned, the Coast Guard and the NDRF team already alerted the fishermen, and they've already told them not to venture to deep sea. And most
Shishir, I'm running short of time. I'm sorry, I'm interrupting you here. We'll come back to you a little later. Meanwhile, let me quickly go across to my colleague Aisha Khanam joining us from Bangalore. Aisha, before we wrap up this newscast, a quick one on the arrangements in place ahead of cyclone Taute's fall.
Sakal, the cyclone hit Karnataka coast yesterday, and it has left a trail of destruction and devastation across the coastal region of Karnataka in the three districts, that is Dakshin Kannada, Udupi and Uttar Kannada districts, and 4 deaths have been reported so far. So there has been intermittent rainfall, and the rainfall is accompanied by gusty winds speed up to 70 to 90 kilometers per hour, and this is causing huge destruction across the coastal line. It has uprooted several coconut trees and electric poles, and the rain water has also inundated many places along the coastal region. And the major impact is on the coastal roads because of the waves and the rough sea. There is sea erosion, and the villagers are worried about the fact that most of the roads will sink in, and therefore they are making temporary arrangements and arranging sandbags around across the coastal line.
Okay.
So far, the government has also started over 11 relief centers, and about 318 people have been evacuated to these relief centers. And the government says that it will release over 15 crores to help rebuild and rehabilitation in this region. And besides this, the government has given instruction to see to that the COVID treatment is not affected,
yes,
and all the hospitals are given.
That is very important.
Generators.
COVID treatment and COVID care hospitals, the infrastructure there should not be impacted adversely. Thank you very much, Aisha. That's all we have time for. Thank you for those quick updates. And with that, it's time to wrap up this newscast. Meanwhile, news updates continue on your channel DD News in DD India. Stay tuned with us. Namaskar.